Now to a new spinal recovery program that's been in Australia for just 1 month. It's called Walk On. Lauren Riley has met some of the amazing people behind the concept.
I was doing something I've been doing on a Thursday, every Thursday for 12 years, I think.
It was a Friday night and I'd gone and caught up with my friend.
We were leaving a boat ramp. I rolled, I went over the bow, and as I went over the bow, my head tilted forward.
Fell asleep and woke up in hospital in Adelaide. I was in immense pain.
For Alan and Simon, it's a haunting memory.
I didn't know if my life was over, but I really wanted it to be.
And they're just two of approximately 10,000 Australians living with a spinal cord injury. At present, there's no cure, but now, thanks to Walk On, an Australian version of Project Walk, for spinal cord injury patients, there is hope.
Well, the possibility of walking again is, of course, one of the things that we push towards, but it's definitely not something that we guarantee.
It's called the Dazinski method, and the aim is to teach patients how to form new pathways between the damaged nervous system and the brain.
You're thinking in your head, wiggle my toes, and that information gets to wherever it is that injury is, and then it doesn't get through. So what we teach our clients is to really focus on the individual muscle group that we're working on. They're sending that information to that area, and we're acting as their body responding to it.
Patients train for 2 hours 3 times a week, and there's no denying it's one of the most intense exercise-based recovery programs available.
I can tell you're working hard.
It's hard work, but I think that's really the best part about it.
Trainers like Brianna are currently in Brisbane to pass on their skills to Australian exercise physiologists.
So I want you to engage your quads.
Yep.
And squeeze through your glutes.
Prior to the program's launch, in Australia the spinal recovery process ended after patients received basic physiotherapy to learn how to live with their new injury. But now, on top of increasing mobility, the walk-on techniques give patients the option of decreasing pain, depression and skin tissue breakdown. Alan became a paraplegic from the chest down a year ago. Whilst in hospital, he booked his flight to America to take part in the exercise-based treatment. Simon has no feeling in his right leg and the bottom half of his left. He's been receiving this treatment for just 2 weeks and is determined to walk again.
Next time I'm talking to you, I might be standing up. I will be standing up.
To help expand Walk On within Australia, funding is needed. If you'd like to help, contact Spinal Cord Injuries Australia.
And I feel healthy and fit and strong, and you know, when you leave the hospital after a spinal injury, a bad one, you leave there with almost nothing, no dignity, no soul, no strength, and sometimes not much courage. So it's really changed my life.
What an incredible program. Lauren Riley with that story.